The recovery unit always smelled the same at this hour. Bleach old coffee plastic. A faint sting of isopropyl that clung to the back of the throat. Monitors kept up their patient beeping steady little metronomes in a room that never really slept. Riley hard adjusted the roller clamp on an IV line until the drip slowed to the exact rate she wanted. Clear fluid flashed once, then fell into a quiet, measured rhythm inside the chamber. Her hand stayed there a heartbeat longer than necessary, feeling the cool plastic checking for the tiniest tremor in the tubing. No tremor, no air, no surprises. She let the line go and stepped back from the bed. The vinyl flooring under her shoes had that faint stick of disinfectant, like walking on something that had been wiped too many times and never quite dried. Behind her, someone laughed a little too loudly. The sound bounced off painted cinder block and glass. "Slow-mo is at it again," one of the interns whispered from the nurse's station. Riley did not turn. The words floated across the space, landed, and slid away. Her shoulders rose and fell once in a controlled breath. In for 4, hold for 4, out for 4. She did not count out loud. Her body knew the pattern. On the far wall, a clock with a crooked frame read 4:21 p.m. The hands ticked with a soft insect click. Sunlight leaked in through the high windows as a thin diagonal smear washed out by the fluorescent tubes humming above. St. Gabriel Medical Center, Post-Anesthesia Care Unit, San Diego. Officially, it was a place for patients to wake up, stabilize, and move on. Unofficially, it felt like a holding pattern in the sky, a place where nothing dramatic was supposed to happen, and everything could at any moment. A cart rolled past her shoulder wheels, squeaking over an uneven seam in the floor. The scent of microwave-heated soup mingled with alcohol swabs. Somewhere, a radio played softly from a break room with the door cracked a pop song cut short every time the overhead speakers popped on. "Riley?" a nurse called. "Can you recheck the morphine on bed 7 when you have a second?" Riley nodded once. The other nurse had already turned away. Nobody waited for spoken answers from her anymore. A nod meant yes. A nod was enough. She moved along the row of curtain tracks, counting breaths, counting steps. Her stride looked unhurried, almost lazy, but nothing in it was wasted. Every turn of her wrist, every reach toward a chart or a pump, had the precise economy of someone who had practiced the same motion hundreds of times, under conditions much worse than this. At the foot of bed 7, she stopped. The patient lay half-turned to one side, mouth slightly open, tracing the shallow rhythm of post-op sleep. The monitor at his head showed a good sinus rhythm, oxygen saturation solid. The morphine bag hung half-full, label facing outline kink-free. Riley checked the infusion rate, skimmed the chart, made a quick mental calculation. Weight last dose, pain score before sedation. Everything fit. No need to adjust. She reached up and smoothed the tape on the IV hub anyway, thumb running over the edge to make sure it lay flat. Her fingers were strong and square, the knuckles faintly thickened skin slightly rough along the base of her palm. Not the hands of someone who spent a life typing. "Hart," a sharp voice cut across the unit. "Nurse Hart, are we on a coffee break or what?" She looked up. Dr. Nathan Cole stood at the center of the main aisle, white coat open over light blue scrubs, stethoscope looped loose around his neck. One hand held a tablet, the other his phone screen glowing between his fingers. He did not put either of them down as he spoke. Around him, 3 interns straightened like someone had yanked strings attached to their shoulders. Riley slid the chart back into the slot at the end of the bed and walked toward him. Not faster, not slower. Just the same measured pace as always. "Yes, doctor," she said. He looked at his watch in a way meant for an audience. "Bed 12. He said loud enough for the interns and the 2 nurses at the station to hear. "When did you last change the central line dressing?" Riley did not have to think about it. A small part of her did it anyway. 4 hours and 11 minutes ago, she replied, within the 8-hour window per protocol. 4 hours and 11 minutes, Cole repeated, raising his brows at the interns. "You hear that we are timing by the minute here." He smiled, but there was no warmth in it. "That is very thorough, Nurse Hart," he said. "What we could use a little more of around here is speed." The interns laughed, quick and nervous. One of them glanced at Riley and then away as if he had done something rude. Riley held her ground beside Cole, fingers resting lightly on the edge of the nearest rolling cart. Her eyes were calm. If she had an answer in mind, she kept it behind her teeth. He waved his tablet toward bed 12. "Make sure it is dry and clean. And try doing it before the continent drifts another inch, yes." The line got a smirk from one of the interns. Cole turned away, already speaking into his phone about consults and cath labs. His voice faded as he disappeared around the corner. Riley let her hand tighten on the plastic of the cart, for a second then loosen. Her jaw unclenched. She inhaled deeply through her nose and picked up a fresh dressing kit from the supply shelf. From a few feet away near the medication refrigerator, Marjorie Lane pretended to be completely absorbed in double-checking vial labels. The nurse manager's hair was cut short and practical, mostly silver pulled neatly back from a face, lined by years of fluorescent light and half-slept nights. Through the reflection in the refrigerator door, she watched Riley walk away. The younger nurse did not huff, did not roll her eyes, did not whisper to anyone. She simply gathered her supplies and went to do the dressing again, even though she knew she did not have to. Marjorie noticed her hands, the way she opened the sterile package along the seams without tearing too far, the way she laid each piece out in a neat arc on the tray, fingers moving with a fluid confidence that did not quite match the story everyone else had about her. Slow, hesitant, overthinking. Marjorie did not see hesitation, she saw control. As Riley reached bed 12, she greeted the patient quietly, more tone than words, and peeled back the corner of the old dressing. Her gloved fingers lifted the edge of the transparent film in a single continuous motion, skin underneath unbroken, no redness, no seepage. "Looks good," she murmured more to herself than anyone else. The patient snored softly in reply. Somewhere above, beyond the ceiling tiles and the humming fluorescent ballast, something deep and distant rumbled for half a second. A low vibration more felt than heard. The monitor numbers did not flicker, the clock kept steady time. Riley's eyes ticked up once toward the ceiling. The sound faded, the fluorescent hum reclaimed the room. She finished the dressing, pressed the new film into place with the flat of her fingers, smoothing out every air bubble, every wrinkle. When she stepped back, the line sat perfectly under the clear plastic, no shadows, no gaps. The beeping of the monitors blended into the background again. The unit settled into its pale, busy quiet. Feet shuffled at the nurses' station, phones rang, printers spat out thin strips of rhythm reports. Riley disposed of the old dressing, stripped her gloves with a practiced snap, and went to wash her hands. Warm water rushed over her knuckles. She watched the lather swirl around the drain, then shook her fingers once, efficient and quick, before reaching for a fresh pair of gloves from the box. In the metal backsplash above the sink, her reflection looked oddly flat. Pale scrubs, dark hair pulled back from a face that people tended to forget once she stepped away. The only sharp things were her eyes and the lines of the muscles in her forearms when she flexed her hands. Behind her, the intercom crackled faintly, a small cough of static before someone in another part of the hospital called for a respiratory therapist. The words blurred into the general noise. Riley dried her hands on a paper towel and turned back to the rows of beds. There were vitals to check, pumps to clear, charts to update. There was a list in her mind, ordered and prioritized each box, waiting for a silent check mark. Each step taken calmly in sequence in the narrow corridor of light between machines. She took one more breath, set her shoulders, and walked back into the rhythm of St. Gabriel's recovery room. The monitors went on beeping. The clock ticked. The smell of bleach and coffee held steady in the air. Riley Hart vanished again into the work, a quiet figure in sea-green scrubs hands, steady eyes, always moving. The shift moved on in small, ordinary pieces. Riley checked a blood pressure cuff that kept slipping on a teenager's arm, recalibrated a pump for an elderly woman who grimaced every time her hip twitched, and reset a saturation probe that had somehow migrated to the wrong finger. Little things. Necessary things. At the nurse's station, Dr. Cole's voice floated in and out, threading through the noise. "I need that echocardiogram report uploaded before my 5 o'clock, he said into his phone, not really lowering his voice. "If radiology drags again, we will be here all night." He paced in a narrow oval tablet, in one hand, phone in the other. His badge bounced softly against his chest with each sharp turn. His sneakers were new, bright white against the dull vinyl laces, clean soles unscuffed. Every few passes, he glanced up at the monitors visible from the desk, eyes flicking across heart rates and oxygen saturations. He did not linger on any of them. If nothing flashed red, nothing required his attention. An intern trailed behind him carrying a stack of charts, trying to keep up. "So, for post-op PACU patients," Cole said, "I want you thinking about throughput. Stable vitals, adequate pain control, no red flags. In observed and out, efficiency, that is your word of the week." He tapped the intern lightly with the edge of the tablet as he walked past. "Yes, doctor," the intern said. Cole stopped suddenly, frowned at a monitor that had just bumped a heart rate from 80 to 96. The patient was coughing herself awake from anesthesia. Normal, he decided out loud, mostly for the intern's benefit. You worry when the patterns break, not when they wiggle. He resumed pacing. From her position near bed 9, Riley listened without appearing to. She folded a warm blanket over a shivering man and tucked the corners under his feet, careful not to disturb the tangle of lines at his elbow. Marjorie walked up beside her with a portable vital signs machine, the wheels rolling quietly under her steady step. "You take Ward while I finish up with Fenton," Marjorie said, gesturing toward the far bed by the window. "He is all yours today." "Yes, ma'am," Riley replied. There was the slightest softening in Marjorie's face when she heard that voice. She nodded once, then turned toward another curtain where a nurse was asking about a blood sugar. Riley looked toward the bed that now had her name on it. The curtain was half open, letting the late afternoon light angle across the sheets. Ethan Ward lay propped on 2 pillows, his head tilted slightly toward the window. The glow from outside made the edges of his profile stand out in clear lines. He was maybe 50, maybe a little older. Graying hair at the temples, close beard in the stage, between trimmed and forgotten. There were faint sun lines around his eyes, not desk lines, lines from time spent outdoors. The monitor above his head showed a heart rate in the 70s, oxygen saturation at 98, on a low-flow nasal cannula, blood pressure just on the high side of normal. Textbook stable. Riley pulled the curtain a little further closed to cut the glare on the monitor, then stepped closer. "Mr. Ward," she said, voice low. "Can you hear me?" His eyelids fluttered. A moment later, he turned his face toward her. "Yeah," he whispered. "Think so." "Good. I am Riley, your nurse. How is your pain right now, 0 to 10? He blinked as if the numbers had to load in his mind. 3, he said finally. "Maybe 4 if I breathe like they tell me to." His hand twitched toward his right side, toward the bandages hidden under the thin hospital gown. "When you breathe like they tell you to, huh?" Riley echoed. A ghost of amusement slipped through her tone. "That sounds suspiciously like good advice." He gave her a tired half-smile. "They sent some kid to blow up balloons with a plastic tube," he said. "He told me it was important. I told him I was more of a beer guy." Riley took the incentive spirometer from the bedside tray and held it where he could see it better. "This one," she said, "humor me." He sighed, then regretted it and grimaced, one hand pressing against his side. Riley watched his face, not the monitor, waiting for the pain spike to ease. "Nice and slow," she said. "You do not have to impress anyone." He wrapped his lips around the mouthpiece and inhaled. The little white ball inside the clear column lifted, hovered, then sank as he wheezed out the breath. It was not perfect, but it was something. "Good," she said, noting the volume in her mind. "We will keep working on that." "How long was I out?" he asked. "A few hours," she answered. "The surgery went as planned." "Gallbladder," he muttered. "Something that small should not hurt this much." "Small things have a way of being annoying," Riley said. The corner of his mouth twitched again. This time it almost reached his eyes. His chart hung at the end of the bed, thick with printed pages and handwritten notes. Riley scanned it quickly. Routine laparoscopic cholecystectomy, no intraoperative complications documented. Mild hypertension controlled, no known drug allergies. A basic, tidy story. Still, she read each line, absorbing more than just the words. The timing of meds, the surgeon's comments, anesthesia notes. The pattern mattered as much as the individual numbers. She checked his IV site, palpated his hand lightly. Where the catheter sat under the skin, looked for any sign of swelling or coolness. "Any nausea?" she asked. "Some," he admitted. "Smells weird in here." "Hospital scent," she said. "We have not figured out how to bottle and sell it yet." He huffed a small laugh that turned quickly into a wince. Riley made a note in the chart, then adjusted the rate on his pain medication by the smallest allowed increment. "I will keep an eye on that," she said. He studied her for a moment, his gaze surprisingly clear. "You new here?" he asked. Riley paused, pen hovering over the paper. "Why do you ask?" she said. "You move like you know what you are doing," he said, "but you do not talk like the rest of them." She did not answer right away. She finished the note, clipped the pen back to the chart, and only then looked at him. "I have been here 2 weeks," she said. "That is new enough." 2 weeks, he repeated, "so you have not had time to get loud." From the hall, a shadow crossed the narrow band of the light at the bottom of the curtain. Footsteps stopped, then a knuckle rapped lightly against the open part. "Excuse me," a male voice said. "Mr. Ward." Riley turned. A man in a dark gray suit stood in the gap in the curtain. His tie was unremarkable dark blue, nothing flashy. He held a thin leather folder and a tablet tucked under one arm. On his chest, his visitor badge read David King Insurance Liaison. His hair was regulation short, a little too precise for a simple insurance rep. His shoes were polished. Riley's gaze slid briefly to his right ear. A clear earpiece curled behind it, the coil almost hidden against his neck. He caught her glance and smiled as if he had nothing at all to hide. "Afternoon, Chet," he said pleasantly. "I was told this is a good time to check in about some paperwork." Ethan closed his eyes briefly and groaned. "You people never miss a chance," he muttered. Riley stepped slightly forward, positioning herself between the bed and the curtain without making a show of it. "He just came out of surgery," she said. "If this can wait, it should." "It will be quick," King replied. "Just signatures and a privacy disclosure. I promise I am not here to sell him anything." His tone was light-friendly, almost warm. His eyes did not match. They measured the room, the equipment, the exits. Riley held his gaze for 1 second longer than was polite, then glanced at Ethan. "How are you feeling about a quick visit?" she asked. Ethan shrugged his free shoulder. If it gets you people out of my hair sooner, he said, go ahead. Riley nodded once and stepped aside, staying close enough to hear. King moved closer to the bed, dropping his voice into a more personal tone. Mr. Ward, I will leave copies of everything with you, he said. You are entitled to ask questions about any line you do not like. My job is just to make sure the dots are connected. Do I have a choice? Ethan asked. In theory, King said, smiling. In practice, it is a lot easier if we do this now. Riley busied herself with checking a nearby pump, but each word reached her without effort. She watched King's hands as he opened the folder. His fingers were steady movements controlled. Behind her, Marjorie appeared at the edge of the curtain, catching Riley's eye. You good here? Marjorie asked quietly. Riley nodded. I will circle back for his next set of vitals, Marjorie said. Call if you need an extra pair of hands. Riley acknowledged her, then returned her attention to the man in the gray suit and the patient whose chart called him routine. The monitor above Ethan's head ticked on, beeping in an easy rhythm. Out in the hall, Dr. Cole's voice rose again, explaining discharge criteria to another intern. The unit hummed with its usual noise. Riley stood still for a moment at the side of the bed, listening to all of it at once. Then she reached for the chart again and continued her notes, pen-tapping once against the paper before she began to write. By 5 o'clock, the air in the unit felt thicker. The temperature had not changed. The vents still hissed out the same processed coolness, but the room carried a new weight. The kind that came when everyone knew the shift was closer to the end than the beginning, and tiredness had worked its way in behind the eyes. The intercom crackled overhead, announcing a transport request to orthopedics. A transporter in green scrubs rolled an empty gurney past the nurse's station, whistling under his breath. Somewhere down the hall, a bin lid slammed, then bounced once before settling. Riley finished documenting Ethan Ward's assessment and slipped the chart into its slot. King had gone, leaving behind a tidy stack of signed forms on the bedside table. Ethan lay dozing now, his breathing shallow but regular. The spirometer sat within reach, its little white ball resting at the bottom of the column. She checked his monitor once more. Heart rate steady, oxygen saturation good, blood pressure a little elevated but nothing sharp. His face looked softer in sleep, the lines around his mouth looser. Riley moved on to the next bed. 2 curtains down, a young woman in her 20s stirred mascara smudged under her eyes, eyeliner, making gray tracks toward her temples. Her leg was in a brace elevated on a pillow, toes peeking out from the end of a hospital sock. An ACL repair the board at her head said. Riley adjusted the sling of the IV line so it did not tug at the girl's hand. You are in recovery, she said when the woman blinked at her. Your surgery is done. It hurts, the girl whispered. I know, Riley replied. On a scale from 0 to 10, where are you at? 7, she said. Feels like my whole knee is on fire. Riley checked the orders, verified the dose, then pushed a measured amount of pain medication through the line, watching the girl's face and the monitor at the same time. You will feel it start to drop in a few minutes, Riley said. I will come back and see where you are. The girl nodded weakly, tears leaking sideways into her hair. Riley placed a tissue in her free hand before stepping away. At the nurse's station, the buzz had shifted. A pile of discharge folders sat open on the counter. Day shift nurses were finishing notes while night shift filtered in, tying hair back, adjusting badges, trading quick comments about traffic and grocery lists. Dr. Cole stood at the center again, a white circle in a swirl of colored scrubs. Listen, he said to a small knot of interns who had gathered near the computer screens. PACU is not where you dramatize. If you want drama, you go to the ED. Here you think like air traffic control. He held up a hand, counting invisible points on his fingers. Stable and monitored, stabilized, routed, out to the right destination. You do not park people in my unit. You do not let them linger because you're afraid to make decisions. You use criteria. You use checklists. That is how you keep this machine running. One of the interns nodded so hard his glasses slid down his nose. Another typed notes directly into her phone. You see a stable post-op with clean vitals and pain under control, Cole continued. You do not reinvent the wheel, you move them. That gives us space for the ones who do not read the script. He paused, catching sight of Riley returning from the far end. And if your nurse spends 15 minutes smoothing a dressing that is already clean, he added, you gently remind her that we are not frosting a cake. There was a ripple of uneasy laughter. Cole smiled, satisfied with the reaction. Riley felt several sets of eyes flick toward her, then away again. She did not change expression. She dropped the latest chart into the bin, logged into a computer terminal, and began entering data with quick, precise keystrokes. Marjorie leaned one hip against the counter beside her, scanning a medication administration record. Her glasses sat low on her nose. How are your rooms? She asked. Stable, Riley said. Ward is at a 3 for pain with movement 4 if he uses the spirometer correctly. Morphine adjusted within limits. Vitals consistent. No signs of bleed or respiratory distress. Marjorie nodded slowly. And the rest? She asked. Fenton is comfortable, Riley said. No nausea reported. SATs holding. The ACL repairs hurting but coming down from a 7 with the last dose. Everyone is oriented. No new deficits. Good, Marjorie said. She glanced sideways at Riley, eyes narrowing slightly. And you? Riley kept her gaze on the screen for another second. I am fine, she said. You Fernstein, she said. That is not what I asked, Marjorie replied. Riley hesitated, then allowed herself a shallow smile that did not quite reach her eyes. I'm still figuring out where everything is, she said. But the work is the work. Marjorie gave a soft grunt that might have been agreement, then pushed off the counter. If Cole gets too much for you, tell me, she said. He is proud of his machine. Sometimes he forgets there are people holding it together. Riley did not answer. Marjorie did not seem to expect her to. The clock on the wall inched toward 5:15. Outside the high windows, the light shifted from harsh white to something warmer, sliding into the beginnings of late afternoon. A pale gold wash touched the tops of the neighboring buildings. For a moment, the hum of the fluorescent lights almost drowned out everything else. Then a different sound brushed against the edge of hearing, a faint thrumming under the usual noise. Riley's fingers stilled over the keyboard. It was nothing defined, more like a slight change in the way the room felt under her feet. A shiver through the floor that did not match the roll of the carts or the slam of a distant door. A deeper tone tucked beneath the usual register of hospital sounds. She glanced up instinctively, looking toward the ceiling again. The tiles stared back speckled white, set in their metal grid. The vents continued their steady hiss. The monitors kept beeping. No one else seemed to notice anything different. The sensation faded. Riley lowered her eyes and finished her charting. In bed 5. Ethan shifted in his sleep, a small line appearing between his brows. The monitor recorded a brief uptick in his heart rate, then let it settle. His chest rose and fell under the thin blanket, a little shallower than before. Riley walked back to his bedside and paused there, listening. Not to the machines, but to the faint whistle of his breath and the way his fingers curled loosely against the sheet. She checked his pulse manually, fingertips finding the radial artery at his wrist. Warm, regular, not pounding. The skin there was dry, not clammy. He smelled like antiseptic soap and surgical prep, with a faint trace of something else under it, a ghost of engine oil and sun that no amount of scrubbing completely removed. You are doing all right, she said quietly. He did not answer, but the crease between his brows relaxed. At the far end of the unit, a patient coughed, then called hoarsely for water. A nurse hurried over with a small cup and a straw. Someone laughed softly at a joke near the medication room. A printer spat out a strip of rhythm analysis, the paper curling as it fell. The unit seemed full and empty at the same time. Riley moved away from Ethan's bed and began her next set of rounds, eyes tracking monitors, faces, dressings, lines. She noted what was present and what was not. The flesh of a cheek, the angle of a hand, the color under a fingernail. She paused outside one curtain where a family member spoke in a low, worried voice. She looks so pale, the woman said. Is that normal? It is, another nurse answered gently. Her body is still waking up. We are watching her. Riley stepped past, giving them their bubble. She reached the sinks and scrubbed her hands again, more from habit than need. The water ran warm this time, steam clouding the mirror for a second, before the vent pulled it away. In the blurred glass, her reflection broke into soft shapes, then sharpened again. Across the room, Dr. Cole checked his watch, then clapped a hand on one intern's shoulder. Rounds in 20 minutes downstairs, he said. I want us ahead of our numbers this quarter. The intern nodded, eyes wide. Riley dried her hands, tossed the paper towel, and turned back toward the rows of beds, just as the intercom above her head clicked. The overhead speaker crackled, carrying a voice that was calm by practice rather than by nature. Attention all staff, Teague, it said. Please be advised incoming air transport will be approaching the facility shortly. The words hung in the air for a brief second before dissolving into the general noise. At the edge of her awareness, deep under the beeps and murmurs, Riley thought she heard that low thrumming again, distant and patient, somewhere above the plaster and the lights. The announcement faded, swallowed by the constant beeping and murmuring of the unit. Air transport. Somewhere, probably the roof people in another department would be checking landing clearances and elevator access. Down here, no one rushed to a window. There were vitals to chart and patients to watch. The PACU did not look up much. It looked sideways. Riley finished a set of observations on an older woman who kept trying to pull at her oxygen cannula. She repositioned the tubing behind the woman's ears, then laid the call bell where her hand could reach it. You press this if you need anything, Riley said. I need my own bed, the woman grumbled, in my own house. We are working on that, Riley replied. She smoothed the blanket once, then turned toward the monitors at the head of the aisle. For a moment, everything lined up. Heart rates hovered in their safe ranges. Oxygen saturations glowed green. Blood pressure numbers bounced in familiar patterns. Her eyes found bed 5. Ethan's values were steady. The little green line traced out his heartbeat in neat, even peaks. Riley allowed herself a small exhale and moved toward the nearest computer terminal. Behind her, somewhere above the acoustic ceiling, the low rumble returned a deeper vibration this time. It trembled through the metal frame of the light fixtures and hummed in the legs of the IV poles. The clock on the wall buzzed faintly in sympathy. No one commented on it. A tech laughed at something on his phone. A nurse cracked open a fresh packet of saline flushes with a pop. Riley logged into the terminal and began to enter her latest assessments. Her fingers moved fast, hitting keys with controlled precision. She did not look down at them. Her gaze flicked up every few seconds to scan the monitors again. The alarm started without warning. A sharp, high-pitched shriek cut through the low-layered sounds of the unit. The rhythm felt wrong even before the words came. The overhead speakers crackled. "Code Blue," the disembodied voice called. "PACU Bed 5, Code Blue, PACU Bed 5. For half a heartbeat, the room seemed to hold its breath. Then everything snapped. A chair scraped back hard, nearly tipping. A clipboard hit the floor and papers fanned out in a white splash. Someone cursed under their breath. The red light over the nurse's station began to flash in a steady, insistent pulse. Riley was already moving. She did not run. Her stride lengthened, pushing off the floor with more power, but the motion stayed centered, efficient. The path to Bed 5 was clear in her mind, mapped out from the dozens of passes she had already made that day. At the opposite end of the unit, the red metal code cart jolted into motion, wheels rattling as a nurse rammed it into the aisle and drove it forward. The drawers shook, clattering inside their frames. "Coming through," someone yelled. Bed 5 was only a few steps from where Riley had stood. By the time she reached Ethan's side, his body had already slumped into a frightening stillness. His face was colorless under the harsh light. His mouth hung slightly open. The monitor above his head screamed. The green line that had drawn such neat little hills now writhed in a jagged, chaotic pattern. Ventricular fibrillation. Ethan's chest hitched once with a useless shuddering motion, then settled again. A younger nurse was at the bedside, hands hovering uncertainly over his sternum. "Start compressions," Riley said. The nurse pressed down twice, 3 times, arms bent, shoulders high, elbows flaring in and out. The movement was shallow, bouncing more than pressing the sternum, barely sinking. "Harder," Riley said, voice calm, direct. "Lock your elbows, use your body, not your arms." The nurse tried, but her hands slid off center fingers, splaying across Ethan's ribs. Footsteps pounded behind them. Dr. Cole skidded to a stop at the foot of the bed, white coat flaring. His tablet was gone, his phone gone. His stethoscope bounced against his chest. "What have we got?" he demanded. "V-fib," someone answered, pointing at the monitor. "No pulse." "I need compressions now," Cole snapped. "Charge the defibrillator to 200. Get me EPI. Crash cart here yet." "It is coming," a voice called. The wail of the alarm drilled into the space above Riley's eyebrows. She stepped in closer, checked Ethan's carotid with 2 fingers. Nothing. The younger nurse's hands were visibly shaking now. Sweat had already sprung up across her forehead. Inefficient, Riley thought, and the word was not cruel, just clinical. She moved. "Switch," she set her hand firm, but not rough, on the other nurse's shoulder. The younger woman backed away, eyes wide in the harsh light. Riley planted her feet on either side of the bed, one slightly ahead of the other. She laced her fingers together, heel of one hand over the lower half of Ethan's sternum. She straightened her elbows until her arms were rigid pillars. Then she dropped her weight. The first compression drove his chest down with a solid mechanical movement. The ribs creaked the sternum, giving just enough under the force. She let it rise fully, then drove down again. The rhythm set in her muscles instantly. 1 and 2 and 3 and 4. A steady, relentless cadence, each push deep, each release complete. The world narrowed to the rectangle of Ethan's chest under her hands. The monitors, the people, the noise all slid sideways, reduced to distant static. "Compressions are good," Marjorie's voice called from somewhere near the head of the bed. "Keep that depth." Riley did not answer. Her breath came in a steady pattern, just enough air to fuel her muscles, not enough to disturb the counting in her head. The code cart slammed against the side of the bed frame, jolting it. A tech hauled the defibrillator onto the mattress near Ethan's shoulder, hands already moving over knobs and paddles. "Charging, you say?" He said, "Charge to 200, Cole repeated. "Clear the chest. Get those pads on." Sticky pads peeled free from their backing with a harsh rip. The anesthetist at the head of the bed adjusted the oxygen mask over Ethan's face, tightening the strap, squeezing the bag in a firm, regular rhythm. Riley's eyes flicked up for half a second. The mask sat flush, the jaw tilt was good, the bag squeeze matched her compressions. Air flowed, chest rose. Then she returned her focus to the breastbone under her palms. "All right, clear for analysis," the tech said. "On my count," Cole said. Heart stepped back. Riley gave 2 more compressions, finished the cycle, then lifted her hands clear without breaking her stance. "Clear," the tech echoed. Everyone lifted their hands off the bed. The defibrillator whined, then snapped, sending a visible jolt through Ethan's body. His back arched slightly, limbs twitching. The monitor line flattened for a heartbeat, then sprang back into movement. The rhythm that appeared was organized but slow and fragile, like a line traced in faint ink. "Check for a pulse," Cole ordered. Riley's fingers were already on Ethan's neck. She pressed lightly, feeling. There it was, a tiny thump against her fingertips, then another. "Got one," she said. "Good," Cole replied, relief obvious in his voice. "Resume compressions if that drops. Get me his pressures. Start a drip. Epi is in." "Yes, doctor," someone confirmed. The room shifted from frantic to focused. People moved with purpose around the bed, adjusting lines, drawing up medications, checking connections. The alarm volume lowered, replaced by the rapid beeping of the new rhythm. Riley kept her hands ready above Ethan's chest, hovering, waiting to see if the weak pulse would hold. The anesthetist's grip on the oxygen bag loosened slightly. Sweat ran down the side of his neck, glistening in the fluorescent light. A brief calm settled. It was not comfortable. It was the kind of quiet that could crack with the slightest wrong movement. "Textbook," Dr. Cole said, exhaling a short laugh. "You see that, people, recognition of V-fib, immediate compressions, early D-fib epi. That is how you do it. Good work." His eyes swept the room, landing on Riley. "And nice to see that when we ask for compressions, we can actually get them," he added. "Keep that up, Hart, and we might make a sprinter out of you yet." A couple of interns smiled, unsure if they were supposed to. Riley did not respond. Her gaze never left the numbers on the monitor. The heart rate bumped and dipped, trying to find footing. The blood pressure crept into a safer range, digits climbing with each repeated measurement. She watched the tracing, reading subtleties that did not show up in the color of the lines. Ethan's chest continued to rise and fall under the mask. Air moved in and out, but his breaths were still shallow. A faint wheezing hiss threaded through the room under the new pattern of beeps. Riley placed her hand gently on his sternum, feeling the movement beneath her palm. The bone no longer needed artificial force, but something in the rhythm felt slightly out of sync, like a song played half a beat off. "Hart," someone called from behind her. "We need help with a transport order." "In a minute," Marjorie answered for her. "She is here until we are sure he is not crashing again." Riley kept listening. To the monitor, to the hiss of oxygen, to the subtle sounds of Ethan's body trying to decide whether it was ready to stay. The fragile rhythm did not last long. For a couple of minutes, the monitor traced out a slow but disciplined line. Each peak found its place. Each valley returned to the same level. The numbers looked better at a glance. Heart rate in the 80s, blood pressure nudging back toward normal, oxygen saturation holding. People began to breathe again. The anesthetist wiped his forehead with his sleeve. A nurse stepped away from the bed to grab more saline. One of the interns let his shoulders sag, his fingers finally unclenching from the pen he had been gripping. Dr. Cole glanced at the monitor, then checked his watch. "All right," he said, voice a notch lower. "We are out of the woods for the moment. Keep an eye on his pressures. We will reassess his pain regimen once we are sure his heart is behaving." Riley stayed where she was, palms resting lightly on the sheet over Ethan's chest. She could feel the faint lift and fall under her hands. The movement was there, but it was thin, like a tide that had gone out too far. She watched his face. The color had improved from the chalk white of a few minutes ago, but his lips still held a bluish tinge at the corners. Sweat shone along his hairline. "Increase his fluids," Cole said. "Give his circulation a little more to work with." Someone at the foot of the bed adjusted the IV pump. The machine beeped as the rate changed. For a brief span, the code room rhythm shifted into something more routine. People checked syringes and labels. The red light above the nurse's station continued to flash, but the intensity of the moment was already slipping from panic into maintenance. Riley's intuition did not follow. She watched the numbers in the upper corner of the screen. Heart rate, blood pressure, respiratory rate. Each one held for several seconds, then began to creep. The heart rate climbed, 87, 92, 98. The blood pressure, which had fought its way to a safe line, started to falter. A few points dropped away from the top number, then a few more. The diastolic trailed after like a shadow losing contact with its owner. The waveform lost some of its definition. The peaks blunted, the valleys shallowed. "Pressure is falling," a nurse reported, eyes on the monitor. Cole frowned, stepped closer, and leaned in just enough to see the trending numbers clearly. "Could be a response to the epi wearing off," he said. "Cycle again. Let us see if it settles. Get another bolus ready." His tone was still contained, but the easy confidence from moments ago had thinned. Riley shifted her hand to Ethan's wrist again. The pulse that had felt faint but present now had to be chased. It fluttered under her fingertips, then seemed to slip away when she pressed too firmly. She moved her hand to his neck. The carotid beat was still there, but each thump felt weaker than the last. The ventilatory pattern changed too. The bag in the anesthetist's hand met more resistance on each squeeze. Ethan's chest rose, but the left side lagged a fraction behind the right. Riley's eyes tracked the movement. On the right, the ribs lifted in a smooth curve under the gown. On the left, the fabric barely shifted. When it did so late, like an echo trying to catch up. "Dr. Sigi," the anesthetist said. "His breath sounds are not symmetric." Cole's head snapped toward him. "Which side?" he asked. "Right is clear," the anesthetist replied. "Left is diminished. Could be from the compressions. Could be the way he is lying." Riley stepped around the bed to get a better angle. Ethan's neck veins caught her attention. Along the side of his throat, just above the collar of the gown, the veins stood out a bit more than they had minutes before. They pulsed faintly with each beat full and tight. Her mind sorted the pieces without needing to name them out loud. Rising jugular venous pressure, unilateral decreased breath sounds, asymmetric chest motion, falling blood pressure that did not respond cleanly to fluids, tachycardia that did not have the frantic chaos of pure arrhythmia. This was not just an electrical problem anymore. "Heart," Cole said sharply. "You have his baseline chart. Any history of cardiac tamponade, pericardial issues, anything that would predispose him to this kind of collapse." "No documented history," Riley said. "Echo prior to surgery showed normal function. We run through our causes," Cole said more to the interns than to her. "Hypovolemia, hypoxia, hydrogen ion hypo, or hyperkalemia, hypothermia. Tension pneumothorax, tamponade toxins, thrombosis." He ticked them off on his fingers as he spoke, eyes on the monitor. "Fluids are in. Oxygen is in. No signs of massive bleed on the field. Temperature is within range. We have no evidence of new myocardial infarction. This is likely refractory rhythm instability. Get me another milligram of epi." He sounded as if he were reassuring himself as much as teaching. Riley's focus stayed on Ethan's chest and neck. "Doctor," she said, "his neck veins are distended. Breath sounds on the left are almost gone." "We already know his lungs took a hit him," Cole said. "He just had compressions and a shock. That is hardly surprising." "There is more," Riley said. She moved closer, placing her palm flat over the right side of Ethan's chest, then the left. The right side rose firmly against her hand with each ventilated breath. The left side yielded only a slight delayed push. She shifted her palm to feel the space between his ribs, the subtle give of the intercostal muscles. "The left chest is tight," she said. "It is not expanding the same way." Internally, another word formed crisp and unwelcome. "Tension." She pictured the anatomy beneath her hand. The collapsing lung, the air trapped in the pleural space, the pressure pushing inward on the mediastinum choking off venous return to the heart. It was not the heart failing to pump, it was the heart being strangled. "His pressures are still dropping," the nurse at the monitor said, voice higher now. "Systolic is in the 70s. Bolus is in," someone else added. "No improvement." The monitor alarmed again, not as sharply as in VFib, but with a steady insistence. The line on the screen began to wobble, losing its clean contours. The numbers flickered, struggling to find purchase. Cole's jaw clenched. "Another round of EPQ," he said. "Get ready to shock again if he slips back into VFib. We do not let the rhythm tank, we stay ahead of it." Riley lifted her hand from Ethan's chest, fingers curling for a second in the air. "If this is tension pneumothorax," she said quietly, "shocking him again will not correct the mechanical obstruction." Cole turned on her. "What did you say?" he asked. She met his eyes. "I am seeing distended neck veins," she said. "Absent or nearly absent breath sounds on the left. Asymmetry of chest wall movement. He is hypotensive and tachycardic, and fluids and pressors are not stabilizing him. This pattern is consistent with tension pneumothorax." An intern at the foot of the bed looked up quickly at the phrase, then back at the monitor, then at Cole, as if waiting for a cue. "We are in a PACU," Cole said. His voice carried an edge, now brittle and sharp. He had laparoscopic abdominal surgery, not a chest tube placement in a war zone. He took a step toward the bed, leaned in, and placed his stethoscope on Ethan's right side. He listened for 2 breaths, then moved to the left. The room held very still as he listened. He straightened after a moment, expression tight. "Left side is quieter," he admitted. "Could be atelectasis, could be a contusion from compressions, could be nothing that requires a cowboy move." Riley watched the vein in his own neck jump once with his pulse. "With respect," she said, keeping her voice level, "if this is tension, he needs decompression, not another shock." Cole's eyes flashed. With respect, he said the words chilled. I am the physician in charge of this code. You are a nurse who has been here 2 weeks. You do not call attention pneumothorax on the basis of a few diminished sounds without imaging. This is not some field tent. This is a hospital with protocols. The anesthetist shifted his hand, still working the oxygen bag. Doctor, he said carefully, her assessment fits. His trachea looks slightly deviated. Cole spun toward the head of the bed, peered down the length of Ethan's neck and chest. Under the harsh light, the lines were subtle, but they were there if you knew how to read them. The monitor alarmed again. The heart rate spiked into the hundreds. The blood pressure dropped another notch. We do not have time to get a chest x-ray, Riley said. If we wait for imaging, he will arrest again. Enough, Cole snapped. Prepare for another defibrillation. We treat the arrhythmia. Needle decompression of the chest is an invasive procedure that is not indicated here and certainly not initiated by nursing staff. It is not happening. He moved toward the defibrillator, fingers flying over the controls. Charge to the 200, he said. We are not losing him to a rhythm issue we can fix. The tech hesitated, then did as he was told. The machine began to whine, building its charge. Riley felt heat rise in her chest, a slow, dense pressure that was not entirely her own. Every pattern in front of her screamed mechanical problem. The image in her mind of trapped air in a collapsing lung, sharpened bright as a photograph held up to the sun. She looked at Ethan's face, and his eyelids fluttered. His lips had gone paler, the bluish tinge deepening toward gray. The veins in his neck stood out more clearly now. Her hands curled into fists at her sides, nails biting into her palms through the thin latex. Heart, Cole said, not looking at her, back away from the chest. When I say clear, you do not touch him. The defibrillator beeped, signaling it was ready. The room seemed to contract around the bed. Every pair of eyes pointed inward. The red light over the nurse's station continued its steady flash, washing the edges of their faces in a faint, intermittent glow. Riley took one step closer instead of back. The words in her throat gathered, taking shape, pressing upward against the tight control she had built and maintained for 2 weeks. She put her hand out toward the bed rail, fingers brushing the cool metal, and drew in one measured breath. Dr. Cole, stop. Riley heard her own voice cut through the noise sharper than she intended. It slid under the alarm and over the whine of the charging defibrillator, clear and unshaken. Cole's hand hovered over the paddles. His eyes lifted slowly to her face. Excuse me, he said. Jemand? Und kann sie, Giễu said. You shock him, now you worsen the collapse, Riley said. This is not just rhythm. The problem is mechanical. Heart, he replied, and the word came out clipped. You are out of line. Step away from the bed. His fingers tightened on the paddles. The defibrillator beeped, fully charged, the sound taut and insistent. Riley did not move. Look at him, she said. Look at his neck, his chest. Not the monitor, him. For a second, no one else in the room breathed. Ethan's veins stood up in stark relief along his throat, bluish cords against pale skin. His left chest barely rose even under the forced breaths. The skin above his collarbone seemed tighter than it had a few minutes earlier, as if something under it pushed outward. Heart, Cole repeated, voice rising. I am not going to argue with you during a code. You are done here. Someone get security to remove her from the bay. A couple of interns exchanged a quick, panicked glance. No one moved toward a phone. Marjorie took one step forward instead. She did not touch anyone. She simply put herself at the side of the bed within arm's reach of both Riley and Cole. Hart is concerned about a possible tension pneumothorax, she said evenly. We should at least consider it. We do not stab a needle into a man's chest on a hunch, Cole snapped. His face had flushed color creeping up from his collar. Not in this unit. Not under my name. The room vibrated again. This time it was not just in Riley's imagination. A low, deep rumble rolled down from somewhere above them, a sound too heavy to be anything inside the unit. The fluorescent fixtures rattled in their housings. Dust sifted from a seam in one of the ceiling tiles, sprinkling down in a fine gray curtain near the far wall. The red light over the nurse's station kept flashing, but its glow now seemed weak against the new presence pressing down through concrete and steel. What is that? One of the interns whispered. The defibrillator continued to hum in Cole's hands, full of stored energy, waiting for direction. From down the main hall beyond the double doors came the faint echo of hurried footsteps and raised voices. A cart banged against a wall, followed by a muffled curse. The overhead speaker crackled again without the usual tone. Code Sentinel in effect, a voice announced from somewhere in administration. All relevant units prepare for secured access. The words meant nothing to most of the people in the room. Heads tilted, confusion folding across faces. The interns looked at each other as if one of them might magically know what that code meant. Riley's stomach went cold. Code Sentinel. The syllables landed like weights in her chest. Training rooms, briefings, simulations. The words did not belong to St. Gabriel. They belonged to another life, one she had spent 2 weeks keeping in a locked, sealed box. The doors at the far end of the PACU slammed open. A man in a too large blazer and a loosened tie burst through breath already short. His hospital ID bounced wildly on its clip. His glasses had slipped down his nose and sweat darkened the collar of his shirt. "Dr. Cole," he called, voice cracking with urgency. "Dr. Cole." Cole glanced over his shoulder, irritation cutting through his concentration. "In the middle of a code," he barked. "Unless this is about this patient, get out." "It is," the man gulped. He dodged around the code cart, almost clipping an IV pole. "We have a Navy helicopter on the roof. They bypassed tower clearance. They declared Code Sentinel and requested immediate access to this unit." "This unit," Cole repeated in disbelief. The building shuddered again. The rumble overhead was now undeniable, a heavy rotational roar that seemed to reach right inside their chests and vibrate their ribs. The fluorescent lights flickered once, twice humming louder than before. "Yes," the man said, chest heaving. "They said they are here for a high-value asset under post-operative observation and a specialist currently assigned to PACU. They asked specifically for a specialist Riley Hart." Silence fell in a sudden disorienting wave. The defibrillator hummed. The monitor beeped. Ethan's shallow breaths hissed past the mask. But inside the ring of staff around bed 5, everything else froze. Every head turned toward Riley. She felt the shift physically, the weight of dozens of stairs pressing against the side of her face. The air in her lungs seemed to thicken. Cole stared at her as if he had never seen her before. "This is some kind of mistake, Siviosa," he said finally. "She is a PACU nurse, a very slow one." The administrator's gaze flicked between Cole and Riley, then down to the paper trembling slightly in his hand. "They repeated the name 3 times, he said. "Specialist Riley Hart, Code Sentinel." They said time-sensitive. Marjorie's eyes had widened, the brown of her irises ringed with pale surprise. She looked at Riley, and in that look, Riley saw not confusion, but pieces slowly clicking into place. The faint scars along Riley's forearms, the calluses, the way she moved during the earlier compressions, the way she had read Ethan's signs without needing the monitor to tell her he was in trouble. The building shook again. This time it was not just vibration. A distinct rhythmic thumping pressed through the ceiling, a heavy spinning cadence, the sound of blades cutting air at close range, the kind of machine that did not belong to news crews or traffic reporters. Riley's heart hammered once, then settled into a very specific, very familiar pattern. Her vision sharpened. The edges of the room snapped into crisp focus. The code around the bed did not pause completely, but its pace faltered, everyone thrown off by the intrusion of an entirely different urgency. Ethan's blood pressure dipped again on the monitor. The numbers slid into the high 60s. The alarm bleated less piercing than before, as if even the machine could tell it was being upstaged. "Doctor," the anesthetist said, voice taut, "he is tanking." Cole shook himself, glaring at the administrator as if sheer force could make him disappear. "Get them off my roof," he snapped. "Tell them this is a secured patient under my care, and we are in an active code. I will not have some military exercise disrupting my unit." Before the administrator could answer, the doors at the far end opened a second time. This time, the person who stepped through moved with a different kind of urgency. He wore dark navy utilities, not camouflage, but the kind of uniform built for work rather than show. A heavy radio pack strapped across his chest antenna protruding over his shoulder. His hair was close-cropped, his jaw shadowed by a day's stubble. The badge on his chest carried an eagle and a name, Grant Lucas. Rank insignia gleamed at his collar. He walked without hurry, yet each step ate up distance. Conversation died in his wake. His gaze swept the unit in a quick, efficient scan. Exits, equipment, personnel, patients. The entire space took shape in his eyes in a heartbeat. He did not look at Dr. Cole first. His attention locked onto Riley where she stood at Ethan's side, hands still resting against the bed rail. "Specialist Hart," he said. "Not a question." The word specialist felt strange and natural at the same time. It fit her better than nurse, though she had been wearing the second label for 14 days. For a moment, Riley's mind split. Part of her remained anchored in the PACU and the hiss of oxygen and the beep of monitors and the weight of protocols. Another part snapped back to briefing rooms with no windows to dust and fatigue and the smell of jet fuel, to a voice very much like Grant's calling her by that same title. She straightened before she quite realized she had done so. "Commander," she answered. Cole's head jerked between them. "Who are you?" he demanded. "You cannot just walk into my unit and hijack my staff in the middle of a code." Grant gave him a brief look, one that assessed and dismissed in the space of a breath. "Commander Lucas Grant, United States Navy," he said. "Operational command for Sentinel assets in this sector. We are here for Echo 9, status." He turned back to Riley before Cole had a chance to reply. Riley's eyes went once to Ethan, then to the monitor, then back to Grant. Echo 9 is unstable, she said. Her voice had shifted, the soft edges gone, replaced by clipped precision. Post-op lap cholecystectomy as cover for deep tissue device placement in the right upper quadrant. No primary intraoperative complications. Secondary decompensation in PASU. Initial event V Phoebe arrest. ROSC achieved after compressions in one shock. Now demonstrating hypotension. Tachycardia, distended neck veins, unilateral decreased breath sounds on the left, and asymmetric chest expansion. Non-responsive to fluids and pressors. Grant absorbed the information without writing anything down. Assessment? He asked. Acute tension pneumothorax left side, Riley said. He needs immediate decompression before any attempt at transport. If we take him up without relieving the pressure altitude, we'll finish what the pressure started. Cole spluttered. This is outrageous, he said. You cannot seriously be taking field diagnostics from a nurse over my medical authority. We are in a fully equipped hospital. We follow protocol. We need imaging, not gut feelings. Grant looked at him fully now. Doctor, he said, and his tone carried no heat. Only iron. This man is a classified national asset under Sentinel protection. She is not just a nurse. She is my medic. When she says tension, I listen. The room went very still. Riley felt every eye swinging toward her again. She kept her focus on Grant. Compression is ongoing, Kwapti, she said. We have seconds, not minutes. I recommend immediate needle decompression in the second intercostal space midclavicular line on the left. After that, we can talk about how and when you want to move him. Grant nodded once. Do it, he said. Cole stepped forward, fury and fear fighting on his face. You cannot just let her cut into my patient, he nearly shouted. She is outside her scope. I will not be responsible for that kind of reckless improvisation. Marjorie's hand came up light but firm, touching his sleeve. Doctor, she said quietly, if she is who he says she is, she has done this more times than any of us ever will. Ethan's monitor shrieked again. His pressure dipped another notch. The numbers flashed yellow, then red. Riley moved to the side of the code cart, fingers already reaching for a large bore needle, her mind slipping into a mode that had nothing to do with St. Gabriel's policies and everything to do with muscle memory forged far from this fluorescent light. The roar of the helicopter above settled into a steady grinding churn like a heartbeat laid over the building itself. Riley's hands found the kit almost before her eyes did. The top drawer of the cart opened under her pull metal gliding on metal. Packages of syringes, ampules, gauze, and catheters lay in neat rows. She pushed aside a tray of smaller needles and reached for the long 114 gauge, 3 1/4 inches sealed in clear plastic. Her fingers closed around it with a familiarity that did not belong to this hospital. Large bore 14, she said aloud, more for the room than for herself. The tech beside her stared for half a second, then stepped back to let her work. Dr. Cole moved to block her path. You are not putting that in his chest, giễu, he said. His voice shook on the last word. I will not allow it. Riley did not stop walking. She turned her shoulder just enough that he had to shift or be knocked aside. Commander gave the order, she said. We do not have time for a committee. Your commander does not sign death certificates here, Cole shot back. Grant's voice came in from the other side of the bed, calm and flat. Dr. Cole, he said, you have my assurance that this intervention falls under Sentinel authority. Responsibility rests with my command. You will not be held liable for a call she makes under my directive. I do not care about your chain of command, Cole said. This is still my patient. Then act like it, Riley said quietly. The words dropped into the space between them and stayed there. The monitor screamed again. Ethan's blood pressure slipped into the 60s. His heart raced in the 120s, the rhythm on the screen becoming more erratic. His skin looked waxy now, the gray at his lips deepening. Doctor, the anesthetist said, he's losing pulses. Marjorie stepped closer, placing her hand more firmly on Cole's arm this time. Let her do it, she said. If she is wrong, we will know fast. If she is right, we might still have him. Cole's jaw clenched so hard a muscle jumped near his temple. His eyes darted to Ethan's face, then to the monitor, then to the needle in Riley's hand. He did not step aside, but he stopped trying to physically block her. It was enough. Riley snapped the package open along its seam. The needle slid into her gloved palm cold and heavier than it looked. She felt the familiar weight settle against her thumb and forefinger. I need iodine. She said. A nurse pressed a prep pad into her other hand. Riley tore the foil with her teeth, spat the corner into a trash bag, and swabbed a wide circle over Ethan's upper left chest. The sharp medicinal scent cut through the odors of sweat and stale coffee and plastic. The skin blushed a faint orange under the light. Her fingers traced the familiar map. Clavicle, rib, first space, second, mid-clavicular line. She counted without counting her touch, sure locating the spot where bone gave way to intercostal softness. She heard the low murmur of voices around her, but none of the words landed. The world shrank to the triangle of skin under her palm and the needle in her hand. She remembered night rotations in a tent lit by red lamps, rain pounding on canvas, men gasping in air choked with dust. The way her instructor's voice had sounded in that chaos, steady and relentless. When the clock is already running, there is no later. There is only now and dead. Riley put the tip of the needle against Ethan's chest just above the third rib in the second intercostal space. She angled it slightly toward the middle of his torso to avoid the neurovascular bundle running along the lower edge of the rib below. "On my mark," she said. "Bag when I say, hold when I say." The anesthetist nodded, eyes fixed on her hand. She took in one slow breath through her nose, let it out through her mouth, then pushed. The skin resisted for a fraction of a second, then gave way under the sharp point. She felt the needle pass through subcutaneous tissue, a faint pop as it punched through fascia. There was a moment of firm resistance as it approached the pleura, like pressing a thumb into a rubber ball. Then that gave too. There was a distinct change, a sudden lack of pressure as the needle entered the pleural space. A hot hiss of air rushed out around the hub, loud enough to hear over the alarms and the rotor noise above. It had a wet edge, not clean and dry, but it was unmistakably air escaping from a place it was not supposed to be. The sound sent a visible shudder through the line of people standing at the bed. "Hold the bag," Riley said. The anesthetist stopped squeezing, letting the lungs rest for a moment while the trapped pressure drained. The hiss continued for several seconds, then slowed to a tired sigh. On the monitor, the numbers jerked, then shifted. The heart rate dipped from 122 to 110, then to 100. The blood pressure climbed a shallow rise at first, then more confident. 69 systolic became 78, then 85. "Pressure is coming up," the nurse at the monitor said, disbelief edging into her voice. Ethan's neck veins softened. The tight cords relaxed under his skin, sinking back toward a more natural contour. The bluish-gray around his mouth faded by degrees, replaced with a hint of pink. "Resume bagging," Riley said. The anesthetist squeezed the bag again, watching the chest. This time both sides rose more evenly. The left still lagged slightly, but it moved with more conviction, filling the space that had been pinched and strangled. Riley kept the needle in place for a few more breaths, feeling for any new rushes of air. When the hissing finally stopped completely, she slid the needle out in one smooth motion and pressed a sterile gauze pad over the puncture. "Get me a dressing," she said. A nurse slapped a small transparent patch into her waiting hand. Riley sealed the site with quick, firm movements, palms flattening the plastic against skin until it clung without wrinkles. She pulled her hands back, fingers curled slightly in the air as she watched. The monitor now showed a heart rate in the 90s. Blood pressure ticked past 90 systolic and held there, then edged up another few points. The waveform regained its shape, the peaks sharper, the valleys deeper, tracing out a pattern that looked like a heartbeat rather than a series of desperate stumbles. The alarm, which had been shrilling in continuous bursts, quieted to a series of intermittent beeps, indicating caution instead of catastrophe. "Pulse is stronger," Riley said softly. She set her fingers on Ethan's wrist again. The radial beat under her touch was no longer a ghost. It pressed against her skin with steady insistence. "Radial is back," she confirmed. The collective exhale that went through the room was almost physical. Shoulders dropped, faces unclenched. Someone near the foot of the bed said, "Thank God," under their breath. Cole stared at the monitor, then at Ethan's chest, then at the dressing on the upper left side. "His pressure was in the 60s, he said quietly, as if arguing with the memory. "We had already bolused. The rhythm was not holding." No one answered him. Grant watched Riley more than the numbers. His eyes tracked the way her shoulders relaxed by a fraction, now that the worst had passed, the way her hands stayed steady even as the adrenaline began to ebb. "Any sign of ongoing leak?" he asked. "Not right now," she said. "He will need a chest tube if this is going to be managed long-term, but the acute pressure is relieved." "Good," Grant said. He turned his attention briefly to Cole. "Doctor, your patient is alive in large part because Specialist Heart recognized a pattern and acted on it before it was convenient. That is what I rely on her to do." Cole swallowed hard. A flush crept back into his face, but it was different now, less like anger and more like something close to shame. "We would have gotten there," he muttered. "We were running the H&T list." "You were running it on the monitor," Riley said. Her tone was not cruel, just factual. The answer was in his body. Her gaze dropped back to Ethan. His eyelids fluttered again. There was a slight crease between his brows, but his expression no longer held the same strained, starved quality. She adjusted the blanket over his chest, careful not to press on the fresh dressing. "Stay with us," she said quietly, more reflex than instruction. The overhead rotor noise continued, but it no longer felt like a threat. It had become part of the soundscape, a reminder that another world was waiting just above concrete and brick. Marjorie stepped around to Riley's side eyes on the dressing. "You have done that before," she said low enough that only Riley could hear. "Yes," Riley replied. "In worse circumstances," Marjorie added. "Yes," Riley said again. Marjorie nodded once. The simple acknowledgement carried more weight than a paragraph of praise. Around the bed, people began to move with a different energy. The code cart drawers closed one by one. Someone silenced the residual alarm tones and reset parameters. A nurse hung a new bag of fluids while another double-checked medication labels and times. The room no longer pulsed with crisis, but it had not returned to normal either. There was a new awareness in the way people glanced at Riley, a recalibration in the mental map of who she was and what she could do. Grant lifted his radio, spoke quietly into the microphone clipped to the front of his vest. "Echo 9 is stabilized for interim management," he said. "Breathing improved post-decompression. Prep ground transfer to roof access. We are not taking him up without a chest tube on board. Confirm clearance." Crackling static answered him, followed by a terse affirmative he seemed satisfied with. He lowered the radio and looked back at Riley. "We have a window," he said. "How long before he is at risk of reaccumulation?" "Hard to say without imaging," Riley replied. "But the immediate crisis is over. He can tolerate careful movement now. We should keep him monitored continuously during any transfer. No sudden changes in altitude or pressure." "We can manage that," Grant said. Dr. Cole stepped closer to the bed, stethoscope in hand. He listened to Ethan's chest again, this time with more patience. Right side, left side. The sounds that met his ears were not equal, but they were far better than the thin whispers from minutes before. He lifted the diaphragm away and studied the dressing. "You hit the right spotty." "Yeah, said." The admission seemed to cost him something. Riley answered with a small neutral nod. She did not look for more. The red light above the nurse's station finally went dark. A soft chime replaced the harsh code tone, signaling the formal end of the emergency status for the unit. Activity in the rest of the PACU began to resume its normal flow, although voices stayed somewhat hushed, as if no one wanted to disturb the fragile balance they had just regained. Riley peeled off her gloves, fingers slick with sweat despite the coolness of the room. She dropped them into the biohazard bin, then flexed her bare hands, once feeling the ache in the tendons and the faint tremor that came after sustained exertion. She could already feel the edges of fatigue creeping in the post-surge hollow that followed each intense intervention. She pushed it aside. There was still work to do. She washed her hands, the water running pink for a moment where iodine had stained her skin, then clear. The scent of the prep remained clinging to the fine lines of her fingers. When she looked up, her reflection in the metal backsplash showed a face flushed from exertion, jaw-tight eyes sharper than they had been when the shift began. Behind her in the glass, she could see Grant standing near the foot of Ethan's bed, speaking quietly with Marjorie and the charge nurse. He gestured once toward the corridor that led to the service elevators and the stairwell up to the roof. The paths overhead and at ground level were aligning, and for the first time that day, Riley allowed herself to feel the old alignment inside her, as well, the one that had nothing to do with St. Gabriel's ID badge, clipped to her scrub top, and everything to do with the word specialist on Grant's lips. The unit did not empty, but it rearranged itself. The people who had flooded around Bed 5 a few minutes earlier drifted back toward their own patients, pulled away by monitors and medication schedules. The outlines of the shift reappeared around the edges of the crisis, the usual tasks waiting where they had been dropped. Near Ethan's bed, a smaller circle remained. Grant stood at the foot of the mattress, one hand resting lightly on the metal bar, eyes sweeping over the equipment one more time. Marjorie and the charge nurse, a tall man named Ortiz, stood across from him with clipboards open. "We will need a clear path from here to the service elevator closest to the east stairwell," Grant said. "From there, my team will take him up to the roof. We will bring our own ventilator on the way down from the bird." Ortiz nodded, already sketching on a blank sheet. "I can lock that elevator temporarily," he said. "We will reroute any non-essential traffic. Security will clear the stairwell." "Good," Grant replied. Marjorie tapped her pen against her notes, then looked at Grant. "What about staff access during the transfer?" she asked. "Who is staying at the bedside?" "My team will take over transport," Grant said. "We have a medic unit staged with the helicopter." Marjorie glanced at Riley, standing on the other side of the bed. Grant followed her gaze. "Specialist Hart will ride with us," he added. "She has been attached to Echo 9 since before this facility became part of the equation." The words hung on the edge of hearing for those who had not quite dispersed. Eyes darted back toward Riley again, then quickly away when they realized she might look back. Riley watched Ethan's chest rise and fall. The ventilated breaths were deeper now, more balanced. The dressing over the decompression site lay flat, a small square of plastic over a solution to a problem most of the room had not seen clearly until it was almost too late. "How long until departure?" she asked. Grant checked the time on his watch. 15 to 20 for my team to bring down the transport rig and coordinate with hospital security, he said. "We have a limited fuel window, but we are within it." Riley nodded. She picked up Ethan's chart, flipping to the last page where she had documented the decompression. Her notes were tight and precise letters marching in small, neat lines. She wrote a few more sentences detailing the immediate post-procedure response, the changes in vitals, her impression of his current stability. Then she added one simple line: "Patient now suitable for controlled transfer with continuous monitoring." Her pen left a small point of ink at the end of the sentence, heavier than the rest. "What exactly is this?" Ortiz asked, quietly, keeping his voice under the general noise. His gaze flicked to Grant's badge, then to the radio at his chest. "We get airlifts in and out trauma from offshore, that kind of thing. We do not usually get codes from the roof telling us our nurses are theirs." Grant's mouth twitched, not quite a smile. "Echo 9 is part of a monitoring program," he said. "Sensitive data, sensitive context. I am not at liberty to give you details, but I can tell you that his presence here required someone like her." He tilted his head toward Riley. "Her file reads like an equipment list every unit wants and nobody gets," he added. Ortiz let out a soft, low whistle. "Wish someone had sent us a memo," he said. "Need to know basis," Grant replied. Marjorie folded her arm. "Apparently we needed to know about 5 minutes ago," she said. Grant inclined his head. "You know now," he said, "and your unit did not fold under pressure. That matters." Marjorie accepted the words with a tiny nod, but her eyes were already back on Ethan, on Riley, on the small radius of space that had become the center of the hospital's attention. Dr. Cole hovered just outside that radius. He had moved away when Grant began discussing logistics, but not far. He stood near the end of the neighboring bed, stethoscope around his neck chart, in hand, pretending to review labs that had not changed since morning. His gaze kept drifting back to the dressing on Ethan's chest. He watched Riley set the chart down and adjust the infusion pumps one more time, making sure the lines were untangled and the tubing did not snag anywhere along the rails. When she straightened, he stepped closer. "Nurse Hart," he said. The title sounded different now, less like a label, and more like a place he was not entirely sure he had a right to approach. She looked up at him. "Doctor," she answered. For a second, his usual confidence flickered. He cleared his throat. "I misjudged the situation," he said, each word deliberate, "on several levels." Riley did not rush to fill the silence that followed. She waited. "I saw V-fib," he went on. "I reached for the algorithm. The algorithm is not wrong, not in general, but I used it like a shield. I did not listen when you said the pattern on the body did not match the pattern on the screen." He exhaled. "I told you this is not a field tent," he said. "I said we do not stab chests here. I was wrong about what this room can be when it needs to be, and I was wrong about you." Riley studied his face. He did not look like a man offering a polished apology. He looked like someone examining a fracture in his own reflection. "There was not much time," she said. "You went where you have been taught to go. It almost worked." Almost in this context had the weight of a closed door. He took in the word the way she said it and nodded. "You saw it before I did," he said. "You trusted it. I did not." His hand lifted as if to gesture, then stopped, fingers curling into his palm instead. "You talked about protocols," she said. "We need them. They keep us from improvising when improvisation is the wrong move, but they are tools, not blindfolds." He let out a rough half laugh that did not have much humor in it. "You are telling me not to throw out the book," he said, "just to read it with my eyes open." "Something like that," she replied. He looked past her at Ethan. "I am trained to say I saved him," he said softly. "It is built into everything we do, the way we talk about cases and outcomes. I will have to sign off on these notes, and I do not think I can write that sentence with a straight face right now." Riley glanced at the chart where her handwriting filled the last page. "You can write that your team kept him alive long enough for a different intervention to matter," she said. "That is not a small thing." Cole considered that, his brow furrowing. "My team," he repeated. His gaze moved briefly toward the interns, who were now on the far side of the unit, whispering to each other in urgent low voices, while pretending to check medication times. "They saw everything, Theo," he said. "They saw me hesitate. They saw you act. They saw a commander from the roof walk past me to you. They saw a lot of things," Riley said. "They will decide which details to keep." Cole's eyes came back to hers. "What will you do?" he asked, "when you leave this place?" The question seemed to surprise him as much as it did her. It had slipped out from somewhere unguarded. Riley looked down at Ethan, at the lines of his face, at the way his fingers twitched faintly in his sleep. "The same thing I did here," she said. "Watch, listen, fix what I can." It was not the full answer, but it was as much as she was willing to put into words. Cole nodded slowly. If you ever land in a place like this again, he said, I would like to know it before you show me up in front of half my staff. It was an attempt at humor, but there was sincerity under it. If I land in a place like this again, she said, it will not be by accident. Their eyes held for a second longer, then he stepped back, leaving the space beside the bed open. Marjorie approached a small stack of papers in her hand. You're charting, she said to Riley. I would like a copy of your decompression note. I want it in the training file. There are standard references, Riley said. Textbook descriptions. There is nothing special about how I wrote it. There is something specific about it, Marjorie replied. I want the specifics. The way you noted the physical signs, the sequence, the wording matters. Riley folded her arms loosely. You are going to turn this into a module, she said. Marjorie's mouth curved. Something like that, she answered. We tell the new ones to listen for alarms and watch for numbers. I think it is time we also tell them to look at neck veins. The image of a cluster of young nurses gathered around a copy of her hurried note flickered in Riley's mind, strange and distant. It did not quite fit beside sandstorms and makeshift triage, but it did not clash either. You will scare them, Riley said. They should be a little scared, Marjorie replied. It makes them pay attention. She reached out and squeezed Riley's forearm once, just above the line where the cuff of the glove had left a faint mark. Her fingers pressed briefly against old scars. Thank you, she said. There was no elaboration, no speech, just 2 words that carried the weight of everything she had just seen. You ran a tight unit, Riley said. It made the decision easier. Marjorie let go blinking once, then turned to coordinate with Ortiz about which staff would accompany the transport as far as the elevator. Grant finished his quiet conversation with security over the radio and stepped up beside Riley again. Extra jacket is in the stairwell, he said. It will be cold between here and where we are taking him. I remember, she said. You have been operating undercover for 2 weeks, he added. Any loose ends that need tying before we move you out of this environment? Riley glanced around the PACU. Monitors glowed. Nurses moved between beds, some stealing quick glances her way when they thought she was not looking. The smell of antiseptic coffee and plastic lingered in the air. The clock on the wall ticked past 5:30. Her locker upstairs held a spare pair of scrub pants and a half-eaten granola bar. The ID on her chest would be turned in at some point, revoked in a system by someone in HR who would only see a line on a screen. No loose ends, she said. You say? She said? Grant nodded. Then you are relieved of civilian duty, he said, effective now. The words landed with an odd mix of weight and lightness. Riley looked down at the name badge clipped to her scrub top. Hart Riley RN, St. Gabriel Medical Center. She unclipped it and slipped it into the pocket of her scrub pants without ceremony. You will need that to sign something later, Grant said. After that, you can burn it if you like. She did not answer. She touched Ethan's hand lightly instead, just for a moment, careful not to disturb the IV line. His fingers twitched under hers, curling slightly as if reaching for something. You are going to feel a lot of movement soon, she said softly. You might not remember it. That is fine. Just keep doing the breathing part. Grant watched her, then checked the hallway. A pair of men in similar dark utilities appeared at the far end, pushing a compact high-spec transport stretcher with integrated monitors and a ventilator unit attached at the head. Their movements matched each other, steady and practiced. Ortiz moved ahead of them, clearing visitors and staff out of the path with a few firm, polite words. As the team drew closer, Riley stepped back enough to give them room, but not so far that she had to reach for the connection again. One of the medics, a woman with her hair tucked neatly under a black cap, nodded to Riley in recognition. Specialist, she said, we have your asset. Riley nodded back. Vitals are improved, she said. Left side decompressed, dressing in place. He is still fragile. Slow transfer watch, that dressing keep the head end stable. The medic gave a brief approving grunt. We have him, she said. The process of moving Ethan from the hospital bed to the military stretcher began a careful choreography of sliding sheets, hands under shoulders and hips, lines held high to prevent snagging. Voices called out short, precise cues. On 3, 1, 2, 3. Riley took a place at the head, one hand on the oxygen mask to keep it secure, the other steadying the tubing from the ventilator. For a moment, as they lifted and shifted, her arms bore part of Ethan's weight. It was not much, but it was enough to feel the reality of his body, of the life that had been balanced on a knife edge not long before. They settled him onto the transport stretcher. The military monitors flickered to life as they connected leads displaying his heart rate and pressure alongside their own readouts instead of the hospital's. The numbers were not perfect, but they were strong enough. Riley stepped back just far enough to see the whole setup. St. Gabriel's equipment on one side, the Navy's gear on the other, overlapping temporarily. 2 worlds sharing a patient. Grant gestured toward the corridor. "Let us move," he said. The little convoy formed itself, the transport team at the stretcher, Ortiz and a security guard ahead to clear the way, a hospital nurse at the side to handle any last-minute paperwork, Grant and Riley flanking the head end. The PACU watched as they began to roll out the eyes of staff following until the group slipped past the double doors and into the wider hospital corridor. The corridor outside the PACU felt narrower than it had that morning. Fluorescent lights buzzed overhead, lining the ceiling in a straight path toward the service elevators. The wheels of the transport stretcher rolled in a low, steady rhythm over the seams in the tile. Each bump sent a small shiver through the framework, but the team adjusted without breaking stride. "Watch that corner," one of the medics said. Ortiz guided them around a housekeeping cart, one hand raised to discourage anyone from cutting across the path. A visitor in a puffy jacket flattened himself against the wall, eyes wide at the sight of the dark uniforms and the equipment. Riley walked beside Ethan's head, fingers resting lightly on the edge of the mattress. The ventilator attached to the stretcher sighed in measured bursts, pushing air into his lungs with a soft, mechanical patience. The hospital's portable monitor hung from one pole, the Navy unit from another, both screens glowing with numbers that rode close to each other. The elevator doors ahead stood open, held by a security guard with his foot on the threshold. He kept glancing nervously toward the ceiling as if he could see the helicopter through concrete. "All clear," he said as they approached. "No other traffic." "Good," Grant replied. The team rolled the stretcher into the elevator. The interior felt tight walls too close in metal, reflecting the lines of uniforms and cables and tubing. Grant stepped in last and hit the button for the top access level. The doors closed with a soft final sound. For a moment there was nothing but the whir of the elevator motor and the quiet hiss of the ventilator. The small box lurched, then began to rise. Riley felt the faint shift in pressure under her feet, the sense of the building falling away beneath them. It was slow, nothing dramatic, but her body remembered other vertical movements at higher speeds and in rougher frames. Her gaze drifted up to the panel above the doors. The numbers ticked by floor after floor. She could almost map the layout without seeing it. Wards sliding past, offices, storage rooms, the blank, heavy slab of the roof overhead. Grant stood opposite her, one hand braced lightly on the side rail of the stretcher. In the confined space, his presence seemed larger, but it did not crowd her. It was a familiar weight in the room, one she had trained herself to work around rather than against. "You did not tell them who you were," he said. "They did not ask," she replied. "You would have let them go on thinking you were just slow," he said, not accusing, only stating. "Slow is easier to ignore," she said. "Ignored is safer." The medic at the ventilator glanced between them, but kept her attention mostly on Ethan's chest and the rise and fall of the numbers. Grant tilted his head slightly. "Safer for who?" he asked. Riley did not answer. The elevator slowed, then settled to a stop with a gentle bump. The doors slid open to a short hallway with plain concrete walls and a painted metal door at the end. A red sign above it read, "Roof access authorized personnel only." Cold air pushed in from the gap around the roof door. It carried a thin edge of jet fuel and the high, dry taste of outside. The helicopter noise was louder here, no longer a distant rumble. The blades thumped overhead in a heavy, repeating pattern that vibrated the handle of the roof door. The security guard who had ridden up with them moved ahead and unlocked the bar. He pushed it open and the sound spilled in fully. Wind rushed into the hallway, tugging at loose hair at paper at the edges of jackets. The smell of exhaust wrapped around the antiseptic hospital smell and pulled it apart. The sky outside was slipping toward evening. Bands of orange and pink streaked the horizon beyond the concrete lip of the roof. The rotor wash flattened the light, smearing it across the gray surface. The helicopter crouched at the center of the pad, a dark shape with its side door open. The rotor spun in a blurred disk above it, beating the air into submission. A crew member in a helmet and reflective vest stood at the edge of the pad, one arm raised, signaling. The transport team pushed the stretcher forward, muscles leaning into the resistance of the wind. The wheels rattled over the metal threshold, then found purchase on the textured surface of the roof. Riley squinted against the force of the air. Her scrubs whipped around her legs. The thin fabric offered little warmth. Goosebumps crawled up her arms. Grant raised his voice to be heard over the engine. "Jacket," he shouted. The medic who had come up ahead with the stretcher stepped to the side and grabbed a rolled flight jacket from a crate near the door. She tossed it to Riley. Riley caught it against her chest. The fabric was thick and heavy, dark olive, lined with a lighter material that smelled faintly of storage and something familiar underneath. She slipped her arms into the sleeves, feeling the weight settle across her shoulders. The cuffs closed snugly around her wrists. It fit as if it had been waiting for her. They reached the helicopter. The crew member at the door leaned out, grabbing the head end of the stretcher to help guide it up the short loading ramp. "In," he called. "Watch your footing, mind the cables." The interior of the helicopter yawned open in front of them. The space was lit by dim, red-tinted lamps that made everything inside look carved out of shadow. Straps hung from rails along the ceiling. Equipment cases were secured to the walls with clipped webbing. The transport stretcher clicked into a locking mechanism on the floor with a satisfying metallic sound. The medics moved in tight practice motions, securing straps over Ethan's chest and legs, double-checking connections, snapping their own harnesses into place. Riley climbed up into the cabin and sank onto the narrow jump seat at Ethan's head. She clipped the belt around her waist and over her lap, then tugged it tight. The floor vibrated under her boots, every movement of the rotors transmitted through the frame. Grant stepped up behind her, one hand on the door frame. He leaned in close enough that she could hear his voice without having to watch his lips. "You good, You good?" he asked. "Yes," she said. He searched her face for a second, then nodded and dropped back down to the pad. He slapped the side of the fuselage twice. "Door," he called to the crew. The side door slid along its track with a heavy grinding motion and closed with a solid thunk. The noise from the rotors dimmed, sealed behind thick insulation and layers of composite. Inside, the world narrowed again. The constant thud of the blades overhead became an enveloping presence rather than an intrusion. The red light painted everything in muted tones. The medic at the ventilator switched the tubing from the portable unit to the onboard system. The new machine took over with a different rhythm, the sound sharper, more precise. Monitors blinked as they synced with the aircraft's power supply. Riley rested her hand on Ethan's shoulder, feeling the subtle jostle of his body as the helicopter pilot increased power. The deck tilted slightly as they lifted from the pad, then corrected. She looked out through the small round window beside her seat. St. Gabriel Medical Center, with its glass fronts and concrete corners, fell away beneath them. The roof shrank to a neat rectangle with a fading red H in the center. The city spread out in a grid beyond its streets, catching the last of the sunlight on their windshields and windows. From this angle, the Passeau was just another lit rectangle behind one of the facades. The people inside were too small to see, but Riley could picture them. Marjorie at the station. Ortiz talking to security. Cole at a computer staring at a screen and not seeing the numbers for a few moments. The helicopter banked gently, turning toward the bay. Water flashed into view, catching the sky's colors and breaking them apart in little ripples. Docks lined the shore, cranes and ships reduced to toy shapes from this height. The jacket around her shoulders held the warmth in now. The familiar weight of it eased a tension she had not realized she had been carrying in her back. It felt less like putting on something new and more like reclaiming something she had set aside temporarily. She drew in a breath. The air in the cabin smelled like fuel oil, metal nylon, and the faint trace of coffee from a thermos someone had stowed in the corner. It was a different kind of antiseptic, one she trusted more instinctively than bleach and floor cleaner. The medic across from her glanced up from the monitor. "Nice work downstairs," the woman said. Her voice was louder than normal to ride over the background noise, but not forced. "He was circling the drain when they called us." "Wrong kind of pressure," Riley said. "Looks better now," the medic replied, nodding toward the numbers. Riley looked at them. Heart rate in the low 90s, pressure holding. Oxygen saturation solid in the high 90s on the ventilator. "He is not out of trouble," Riley said. "He is at least in the same room as it now," the medic answered. They let the cabin settle into its own rhythm. The pilot spoke briefly over the intercom about altitude and estimated time. The words floated around Riley's awareness, slotted into a familiar framework she did not need to consciously follow. She looked down once more at the hospital, now a cluster of lit windows in the distance. 2 weeks of moving along that corridor of light. 2 weeks of blending in. 2 weeks of letting people underestimate her on purpose. Her hands flexed in her lap, fingers remembering dozens of small adjustments, hundreds of slow motions that had never made anyone blink. On the stretcher beside her, Ethan's chest rose and fell steady under the straps. His eyes stayed closed, but the tension had drained from his brow. Riley adjusted the blanket near his shoulders, pulling it up an inch where the draft from the ventilation system slipped under the edge. "Keep going, she said under her breath, not sure if she meant him or herself. The helicopter flew on. Morning made the recovery unit look softer than it had the afternoon before. Sunlight pushed through the high windows in long, pale bars cutting across the rails at the foot of the beds. The harsh white of the overhead bulbs mixed with the natural light and took on a warmer tone. For a brief hour between the early rush and the midday turnover, the noise level dipped. Monitors still beeped, but not all at once. Pumps clicked, voices stayed low. At the nurse's station, a fresh sheet of paper was taped to the wall beside the usual postings about hand hygiene and flu vaccines. The corners were reinforced with strips of clear tape as if someone wanted to be sure it would not curl and fall. The header read, "Emergency needle decompression case, ward Ethan Echo 9. Underneath in small even handwriting, the sequence of events unfurled. Initial decompensation signs. Physical findings. Jugular venous distension noted. Unilateral decrease in breath sounds on the left. Asymmetric chest expansion. Non-response to fluids and pressors. Needle decompression performed at left second intercostal space mid-clavicular line. Immediate release of trapped air observed. Subsequent improvement in blood pressure, heart rate, oxygenation, and chest mechanics. The signature at the bottom was neat. R. Heart RN Specialist. Someone had circled that last word in red pen. An intern stood in front of the page holding a styrofoam cup of coffee forgotten in one hand. His eyes moved over the lines for the third or fourth time. They posted it, another intern said, coming up beside him. The note. I see that, the first one answered. He traced the line about neck veins with his gaze. I did not even look at his neck, he said quietly. Me either, the second admitted. From the far side of the station, Dr. Cole watched them for a moment. His white coat was folded over a chair back. He wore scrub pants and a plain t-shirt, a stethoscope around his neck. He looked as if he had come in earlier than usual. He stepped closer, joining them in front of the paper. You were not the only ones, he said. The interns straightened. Doctor, one of them said. Cole studied the note again. He did not seem to be reading it for the first time. There were faint creases in the paper that suggested it had been folded and unfolded more than once before it went up on the wall. When you run a code, GUI said, you will feel the pull toward the monitor. It is bright, loud, clear. It gives you answers in numbers. That is useful, but it is not the only thing. He tapped the word distension with his fingertip. This was there before the alarm changed tone, he said. So was this. His finger moved down to the phrase about chest expansion. You miss these, you stay in the wrong lane longer than you can afford, he said. One intern swallowed. I thought we did all right, he said. We got row-esque. We followed the steps. You did, Cole said. You also watched someone smarter than all of us at that moment tell you we were missing something and you saw me ignore her. He did not raise his voice. The words were calm matter of fact. You are going to remember that, he added. You should. He stepped back, letting them stand in front of the paper again. The interns exchanged a glance more solemn than the night before. On a nearby counter, a small pile of photocopies of the same note sat in a tray labeled Training Materials. A sticky note on top bore Marjorie's handwriting. Read this, twice. Marjorie herself stood at the head of a small cluster of nurses near the medication room, a clipboard in her hand. We are adding a new block to orientation, she said. Field-style assessment. You will still get your protocols and your meds and your checklists. I am not taking any of that away. She looked around at the faces, new and old. But once a week, she continued, we are going to stand by a bed without looking at the monitor first. You are going to tell me what you see, not what the machine tells you, what you see. A young nurse with her hair pulled back in a high bun raised a hand. What are we looking for? She asked. Marjorie pointed her pen toward the wall where the decompression note hung. Start there, she said. There were a few murmurs, some nods. The younger nurses glanced toward the paper, picking out details with fresh attention. Is she coming back? One of them asked, almost as an afterthought. Heart? Marjorie's pen tapped once against her clipboard. No, she said. She was never really ours. The nurse frowned. But she worked here, she said. She said, for 2 weeks. Marjorie considered that. Sometimes you borrow people, she said. Sometimes you borrow them without knowing. She broke up the little group with a tilt of her head toward the waiting medication carts. Back to work, she said. We still have a unit to run. They moved off, scattering back toward their beds and patients. At bed 5, the sheets had been changed. Fresh linen lay flat corners tucked tight. Ethan Ward was not there. The spot looked smaller without the equipment clustered around it. A housekeeper pushed a mop bucket past the empty space, pausing just long enough to look at the bare mattress before moving on. Riley's name was gone from the assignment board. Where it had been written in dry erase beside Ward, a new name now sat next to a different bed number. The only place her name remained was on the note at the wall and on a log in the badge office where someone had already put a line through her ID number and marked her as inactive. By mid-morning, the day's new cases began to arrive. From the OR doors, patients came in 2 by 2, still under the fog of anesthesia. Nurses took reports from anesthetists noting blood loss complications, fluid intake. Monitors beeped awake when leads were attached. A young nurse, Emily, guided a post-op patient into bed 9. Her movements were careful, deliberate. She checked the oxygen, smoothed the pillow, adjusted the blanket. An intern hovered nearby with a chart. Pain score, he asked. We will see once she wakes up, Emily said. He watched her work for a few seconds. You are taking forever with that line. He started to say, then stopped himself. The words stuck somewhere between habit and a fresh memory. Emily did not seem to notice. She was busy checking for blood return, her fingers steady on the catheter hub. He cleared his throat. What do you see? He asked instead. She looked up surprised. In her, he added. Not the numbers, her. Her. Emily glanced at the patient's face. The woman's brows were smooth. Her breathing was slow but even. The color in her cheeks was pale but not washed out. Nails pink, hands warm. She is comfortable right now, Emily said. No distress, no signs of pain, stable. The intern nodded. Good, he said. We will watch it. He made a quick note, then glanced once toward the decompression sheet on the wall before moving on. At the nurse's station, Cole sat at a computer scrolling through overnight labs. The reflection in the monitor showed his face thinner in the morning light, the skin under his eyes smudged with a fatigue that had not entirely left since the code. He caught sight of his own reflection looking at the note on the wall. On impulse, he reached into the pen cup and pulled out a marker. Under Riley's signature, he wrote in smaller letters, "Review required reading for all cardiology interns." He capped the marker and set it down. As the morning stretched on, the unit slipped back into rhythm. Pumps beeped if a bag ran low. Nurses answered call lights. An anesthetist came through, whistling quietly on his way to the OR. The intercom clicked on and off, announcing transport's phone calls, occasional pages for attending physicians. Yet the air felt a little different. Conversations at the station dipped lower whenever someone mentioned flight noise. A couple of times, heads turned reflexively toward the ceiling when a distant rumble passed over the building, even if it was just a commercial plane lining up for the airport. The memory of the helicopter's weight on the roof lingered in the structure. Near lunchtime, Marjorie walked the length of the unit with a mug of tea in one hand. She stopped by each bed, not always to intervene, sometimes just to watch. At one point, she paused near an older nurse showing a new hire how to adjust a blood pressure cuff. "Look here," the older nurse said. "See the way the skin looks on her hand. That tells you as much as the number on the screen." Marjorie smiled into her mug. Back at the wall, the decompression note fluttered slightly at the edges when the air conditioning kicked on. The tape held. Outside, far above the hospital roofs, a small dark shape crossed the sky, its outline barely visible against the pale blue. It might have been a helicopter. It might have been something else. The sound did not quite reach the unit. Inside, the monitors kept their steady beeping. Feet moved over the vinyl floors. Hands adjusted blankets, checked pulses, smoothed tape over IV sites. The room held the echo of a different set of hands, of a quiet voice, calling out a diagnosis over the noise of a needle sliding into the exact right space. In the space between alarms and footsteps and the hum of the lights, if someone stood still long enough, there was a moment where the unit seemed to breathe on its own. Then a call light chimed, a pump beeped, and the day went on. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.